restorative range of motion activities to get through some aches or pains. Maybe start at you have a small injury, or it's something to do right at the beginning of rehabilitation services. So what we're talking about is active range of motion, being on a surface where you can bend your knee as far as you can. Like right now, the table's kind of getting in my way. I'm going to scoot down just a little bit. Here we go. So now I can bend a little bit further, but just to allow a good range of motion. So we're talking about full extension of the knee, full flexion as much as possible. And we oftentimes get into stagnant ranges of motion. So normal movement patterns that we go through every day without even thinking about it. And we can lose a little bit of range of motion because we're not looking at our full potential, Ninjago. So looking at our full potential and for the ranges of motion. So a quick little exercise to look at that would be going through with your foot in neutral position. We're going to go into full extension. We're going to go back into full flexion as much as possible and just go back and forth between that. Just active range of motion, nice and simple. You can go super slow, really contract the muscle, the quadricep, looking at getting a good full contraction there. You might feel a stretch on the back side of the knee, the back side of the calf muscle. And then same thing in here as we go and kind of push into that a little bit. Might get a little, maybe feel a stretch here. Might feel what's going on at the knee. So taking a moment to consciously feel what is happening there. So now we also have internal rotation as my foot turns in, and external rotation at the knee joint itself. So there is some rotation that happens there. With my knee bent, it isolates that a little bit more. So I can go into internal rotation, so my foot turns in a little bit, and then extension, and go back and forth between the flexion, extension, along with that internal rotation. So I'm keeping that rotation, introducing the other motions. Now I'm going to extend, go into external rotation. Your hip might move a little bit, and that's okay. But we're emphasizing that external rotation at the ankle and at the knee a little bit. Now we go in flexion, extension here. So just active, full ranges of motion, incorporating the full range and dynamic abilities of the knee joints. We can come into extension and go back and forth, really emphasizing internal rotation, external rotation, back and forth, tick-tock here. Come back to flexion and do the same thing, inside and outside with the ankle. We can go in a circle, internal, flex, external rotation, extend, internal rotation, flex, and just repeating that a couple times, and then reverse that. So looking at the whole dynamic ability of the joint. So it's not under stress, it's not under load, it's a nice, easy, open kinetic chain, meaning the foot's just hanging around, not doing anything, versus a standing position where we're doing maybe body weight squats or lunges, or even like a small hop squat or jump squat, where we're leaving the ground but then coming back, and when we're doing the work, we're in contact with that ground, receiving information from the ground reaction. So nice open kinetic chain activities. It's generally safe to perform because we don't have that external load, or like you might think of with a knee extension exercise where there's the bolster at the knee and you're extending that knee against a force. We don't have those shear forces happening at the knee here. So nice and easy. It's a great restorative motion for post-injuries, for rehab, and just a restorative motion just for everyday life, whether we're an office worker or elite athlete. Just getting that full capacity there, lubricating the joint to its full potential, and making our lives a little bit better, keeping our knees a little bit healthier. Healthy knee, healthy life, healthy mobility. So again, I'm Ethan. Keep moving forward.